leg of the client admissions by going backwards a little bit and add one more comment back here on race and ethnicity. This is a question that we find fairly frequently. The individual doesn't necessarily know what the word ethnicity means, or they're confused by why am I talking about race. And so sometimes making a joke about that. So, hey, how do you self-identify? Black, white, blue, green, purple. And that usually, and if they continue to look, Native American, white, Latino, black, give them some choices, and you'll usually get a response. Okay, let's go up here. This third section is usually unimportant until it becomes extremely important. And this emergency contact information is used when something bad happens. It might be the death of the client, it might be significant disability, and it gives us a starting point for getting in touch with somebody who might have some information about the individual. So his contact is Albus Dumbledore. He's clearly in area codes out here. And other emergency information, this is usually a good spot to put in. This might be a sister or an ex-wife or a whatever the relationship is. Or whatever other information. The next section down here on medical or other information, this is a question that you have to be fairly thoughtful about how you ask that. A couple of reasons. First is this is not a HIPAA-based data set. So the question is very specifically asked, is there any additional medical or other information that you would like to share with us? And sometimes they need a little prompting on what it is you're talking about. So, hey, do you have a major allergic problem with peanuts or shellfish, or is there just anything that you want us to know? And sometimes you'll get a great deal of information that's really quite relevant. And if it's volunteered by the client, this is the spot to put it down. So in Severus's case, needs he really needs some eyeglasses, but hasn't been able to afford them. And if there's other information that might be shared by the client that you want to note, so in his case has an So in his case, has an interest in finding other wizards living in the area. We are heading in the direction of having a signed ROI as a standard part of the admissions process. It is not in place yet, but it will be shortly. And so we're going to assume for this purpose that Severus has signed the ROI. It was signed on the 30th of 2020. And we're also set up that you can scan that signed ROI and have it hooked to the files. I think that's going to help. We also have the ability to add a picture here, and this will be handled and covered in a separate video. So at the end of this, come down here, hit your save button, and at that point, the individual has been saved. You get kicked back to the main page here since you've admitted him, and let's go put Severus up here in bed 30 down here, check him in, and you should be good to go. The only other part is that in terms of collecting the information on the clients, if you have a skilled person running the admissions desk, it usually doesn't take much more than 5 or 6 minutes to do a complete admissions. It goes along pretty easily. It's just a conversation, and the individual doing the entry just goes with the flow, and they'll set up their own pattern. I strongly encourage everybody to get all of the fields, if possible, filled out. It's very, very difficult after the fact to go back and revisit this part of the system. And the other part is that when somebody's checking in for the first time, they're usually feeling like, I don't know what's going on here. And if this is the questions they're asking, it's a good time to ask those slightly more in-depth questions. The other tip-off is to have an area off to the side where the person can sit down or be separated and feel a little more comfortable to answer the questions. And it usually goes very well. It's not a big deal. So that handles the basic admissions process.